something like 45 million headache sufferers, if I'm not mistaken, if that number is close to being correct. And it's chronic headaches, not just like the one where maybe you listen to your kid's music a little too long, or just something kind of hits you during the day, or it's maybe a little bit of a sinus thing, but something we're talking chronic. Well, if you have those types of chronic issues, there is an awesome place here in Santa Clarita, Valencia, Headache Care, here to talk about all things headache, the causes, which might surprise you as to actually the origin and also the treatments. With me this morning is Dr. Dean Schweitzer from Valencia Headache Care. Good morning.
Good morning. Thanks for having me.
Always good to have you back. Was I right with the numbers right around there?
Yes, that's accurate. 45 million people in this country suffer from some type of headache, debilitating headache, that actually impacts their life.
And we're talking about something where I don't want to go out. I can't take the kids to soccer or to wherever, or I can't even sometimes get to work because of how bad it is.
Absolutely. We lose something like 11 million work days a year just from headaches.
Just from headaches, and a lot of times too, we don't realize where it's from. So we're going to the doctor. Your general physician will probably just prescribe some sort of maybe medication or something to kind of relieve the symptoms, but without really completely treating and or making it go away, correct?
Right, because pain medications, they just mask the problem, but you really have to get to the root of the problem. It's as if you have an infection, your doctor's not just going to give you pain medication and just keep you on pain medication. They're going to go to the source of the problem and get you on antibiotics to get rid of the problem. And so when you have a headache, if you're taking medication, you're just masking it out. We need to get to the source of the problem. We need to find out why you're getting headaches, solve that problem so that you're no longer getting headaches and don't have to take medication all the time. Because it's not healthy for you to take Advil and Motrin and Tylenol all day, or even narcotics, which are worse because they're addictive.
That's true. Well, and especially any ibuprofen can have effects on livers and everything else down the road. I know someone who took that for years and years and years and ended up on dialysis for a couple of weeks in the hospital because of that, and then couldn't take any type of pain medication after that permanently. So that's really important to understand that if you're just masking that for years,
yes,
it could have
that's proven that constant use of ibuprofen or Tylenol is very devastating to the other parts of your body.
It's supposed to just be used occasionally,
yes,
for occasional pain, not for. And when we're talking about headaches, we're talking about migraine headaches, tension headaches, chronic headaches, jaw clicking and pain, tooth grinding and or even ringing in the ears, and vertigo. And I know vertigo is something especially, sometimes people who are older get that, but it happens also in people who are not quite senior citizens.
Vertigo and tinnitus are associated symptoms of headache most of the time. If you just have vertigo as a standalone symptom or tinnitus as a standalone symptom, there's probably other causes from it. But if you have headache pain, chronic pain, jaw pain, neck pain, and tinnitus or vertigo, they're probably all related.
Right. And talking about the neurological issues of chronic pain too, as I mentioned off the air, doctor, that we have a friend of mine spent the day at Henry Mayo Newhall Memorial Hospital in his late 40s, wasn't sure if he was having a heart attack or what, because he was experiencing some mild paralysis on one side of his body. And it turned out because he's a migraine sufferer, that it just the intensity of it just kind of shut him down a little bit.
Well, that's because migraines are a result of a dysfunction in our entire muscle structure of our face, head, and neck. And that's usually due to, almost always due to a biting force imbalance, which then leads to the muscular dysfunction. And it's all innervated by the trigeminal nerve nucleus, which is one nerve nucleus coming off our spine. So everything that's related to our head and neck can follow into anything else. So your friend, for example, had a migraine headache, which led to probably paralysis probably down into his neck and lower. Probably contributed.
Fortunately, he's being he'd been treated for it. I think he's been released, but still might not be a bad idea to check out the Valencia Headache Center. Talking about this, I want to get into really quickly your background and how you formulated this particular organization that you're now heading.
Well, I've been out here in the Santa Cruz Valley for 36 years. I'm a pediatric dentist, and I have a very large group specialty practice, Schweitzer Family Dental Group, where we have pediatrics, orthodontics, and general dentistry. And as part of our general dental practice, we treat patients with sleep apnea. And in the course of educating myself over time and going to seminars and et cetera, I ran into this protocol for treating headaches. And I investigated, educated myself on it, and now I've presented it to Santa Clarita Valley. I'm the only one in Santa Clarita that can actually provide this kind of treatment.
Now, if I'm not mistaken, this was motivated in part by your own experience with chronic headaches.
Yes, I am, or was, I should say, a headache sufferer. I've been suffering headaches my whole life, but I no longer suffer headaches because I put myself through treatment, and I'm basically headache-free. Headaches do no longer impact my life.
That is outstanding. And we think about impact. I mentioned like missing work, missing school, missing events and things like that, but it could also add to tension and stress that can cause other issues with relationships and everything else, right?
Headaches, chronic pain in general, but chronic headaches specifically are very debilitating. They change the aura about yourself. You're very depressed. You're very lethargic, and you're not energetic toward life. And sometimes you'll just go along with it, and other times you just can't go along with it. But if you can get rid of it, gosh, it changes your life.
We are talking with Dr. Dean Schweitzer from the Valencia Headache Care. The website is valenciaheadachecare.com.
Yes.
Correct. And you can learn more about that. We will be back to talk about, now that we've kind of addressed some of the issues around headaches, we're going to be back in a few minutes to talk about some of the treatments that are available.